at TAP, abdomen and perineum. Okay, we're looking at thorax, TAP, abdomen and perineum. Okay, so once again, welcome to MSc Course Mastery. We say welcome to Medicine and Surgery Course Mastery, where we master concepts and concerns in medicine in piecemeal. Okay, do you follow? All right, so what happened is that today we are looking at TAP, all right, and we are looking at it in conjunction with upper and lower limb. All right, so if you notice, there's a complete guide. All right, so it's going to be in series, it's going to be in episode. And this afternoon episode, we are starting with thorax. Okay, so talking about thorax, you can say, okay, let's start with thoracic wall. All right, and say, let's start with thoracic wall. We said there is a simple way you can learn about thorax, and there are basic things you need to understand about thorax. One of those things is the introduction to thorax. Okay, so anything in anatomy must be introduced. So either say the meaning or you say the introduction. Okay, you must talk about introduction to thorax. So you can see here, okay, as they talk about thorax, you see what it means. It's the region between the neck and the abdomen. All right, so in case you are watching this for the first time or for the next time, okay, must always introduce anything you are talking about in anatomy. So just like in upper and lower limb, okay, we said that you must introduce. If you're talking about the bone, you must first of all talk about the introduction. Okay, now after introduction, you see the next thing there is skin and all that. So those are characteristics. So as you talk about that, you talk about characteristics. So I see. So the characteristics, okay, is SMS what? SMS TTD. SMS TTD. All right. So SMS TTD. All right. And then before introduction, we said it is what? Region between neck and abdomen. Okay, neck and abdomen region. So you can call that NAR. Okay, so Iran. So you see now, you've heard of the country Iran? Iran is a country, right? But not only that, Iran, you can connect it with TAP. Are you following? Thumbs up if you're following. Okay, so this one is called teach from book method. I told you we're going to share with you some skills that smart learners, those you call genius, okay, are not willing to share. So we rather under promise and over deliver. In the introductory live session we had yesterday, that was the maiden live episode of MSc Mastery, MSc Course Mastery. Okay, MSc Mastery or MedSearch Course Mastery. Okay, YouTube channel. We promise a whole lot of things. We charge us a whole lot of things. We caution us. Today we are getting into work, not too much talk. And then this is the teach back method. We're also going to make short videos to make this, like this whole thorax now. If you check, it's about so many 70-something pages. Now I told you yesterday, about 70-something. This is just 45. There's another one, another thorax, still materials. And don't forget, these materials are lecture materials. Okay, we are creating this opportunity to learn and to help students appreciate, internalize, accumulate, okay, make it store in their brain, okay, such that it can be remembered anytime. Study it once by storing it and then practice retrieval. And guess what? Anytime it's needed in exams, you won't be struggling. You won't be feeling frustrated or disappointed. So let's go. So we'll just talk about the anatomy of the thorax. We said when you are discussing anatomy, talk about the introduction. All right. And then as you look at the introduction, you see there is a region between the thorax and abdomen. Sorry, between the neck. This is the neck. And see, this is the neck, and this is the abdomen. Okay, where your chest, all right, the chest cage, the rib cage stops. There's a diaphragm between that and where an average person calls stomach. That's not the stomach, please. Okay, that's the abdomen. And if you go closer a little bit, okay, okay, to where you have the external genital, you see something that sack like a bag. It is called pelvic diaphragm. So, pelvic, so that place, okay, the thoracic diaphragm is called abdominopelvic region. So that's why this is called thorax, abdomen, pelvis, and perineum. This is called what? Put it in the comment if you are following. Okay, yeah. So moving away from there, we said now we are going to be a bit slower today because slow and steady wins the race. Slow and steady, it wins the race. Okay. Yesterday we were fast because we needed to say a whole lot. You need to listen to yesterday's this thing very well over and over. So today we've started again. All right. And we said thorax, okay, must be introduced. Thorax simply means the region between the neck and the abdomen. Okay, between the neck and the abdomen. You can also say it's the region between the abdomen and the neck. That's why we said Iran. I for introduction, R for region, A for abdomen, N for neck. Are you seeing how we come out with these things now? We did promise you that we are going to show you how we do some of these things. And I'm still owing you something in this. How do we generate some of these mnemonics? And this, it may surprise you. I'm looking at thorax here for the first time. Okay, as in this acronym you are seeing here, picking the letters of new words to form old word you're comfortable with because we want to retain a new concept. So thorax, Iran. All right. Now we talk about the characteristics. SMS, okay, TTD. All right. SMS, TTD. So you send SMS till daybreak. All right. Okay. You send SMS thoroughly today. You can say SMS thoroughly today. So send SMS thoroughly today. Maybe you have not been sending SMS thoroughly any other day, but today you send it thoroughly. Okay? Are we together now? All right, drop in the comments if you are with us. Okay, so we move on. We now talk about the next concept. And you may wonder, what does SMSTTD means? You can see here, S stands for skin. That's the first thing you find. Meanwhile, this place now is the thorax. Is the thorax. We are going to do a short video sending it to you so you appreciate thorax in few seconds. Okay, as a physical capture. This one is the mental picture, okay, of this script. All right, so you know what introduction for thorax is. What is introduction of thorax? Type it in the comments. Good, good. Take a book, write it. What is where do you start with? Say Iran or Iran. All right, Iran, name of a country, Iran. All right, yeah, that's how you get it. So I for what? Introduction. All right, R for what? Region. A for what? Abdomen. N for what? Neck. So introduction to thorax is the region between the abdomen and the neck. All right, we move on. Next one, we said characteristics. What can you say you can find in the thorax? All right, and that is you can find the skin first. You can see like this skin, you find it there. I'm assuming this cloth was not there. If you're in cadaver hall or your cadaver farm, okay, where you do dissection in preclinicals, you discover that the skin is what you find first. When you remove the skin, you find letter M, which is what? This letter, the first thing is skin. Next thing you find is going to be superficial fascia. That is surface fascia. It's a connective tissue. And you appreciate this better when we are doing histology. Okay, very shortly we'll do histology. Okay, so moving away from there, we said we have deep fascia. So after superficial fascia, you have deep fascia. Okay, so the S is for skin, the M is for muscles, but you don't find muscle next, you find deep fascia. Okay, but to make it easy, you said SMS. However, somebody can say S, S, D, and then M, T, T. I can say SSD or MTT. Whatever is the case, you must understand. So are you following? We've said two things now. This is how to start mastery. Mastery it sounds like plastering. If you cannot plaster, you cannot master. You plaster it one by one. You link it up one by one. You lay one thought upon the other, and you connect. You lay one thought one upon the other and you connect. Where did you start from? Now, we have talked about that. So you can say SSDMTT. No problem. All right. Now, that will stick when you keep using it. All right. And that will take a longer time because that is not a word you are used to. Me, I'm used to SMS. You agree with me? Everybody, almost everybody knows what is SMS. Okay. Short. Uh, so SMS simply means text message. You know now. I'm not talking about the full meaning. I'm talking about the average meaning an average person knows. Okay, SMS. So when they say SMS, you know, so it's common. So you use something that is common for something that's so SMS TTD for me. That's SMS thoroughly today. Okay. Now, but you may say, okay, let me take the way it is here, SSDMMT. This one you need to study over and over, and that's what we are saying. Okay. If you need a longer time to study, then you know you need to know you have the time. Okay. Okay. So we continue. I needed to take a sip of water. Okay. Yeah, because that's one of the things that keep you alert. When you're studying, you need to stay with some fluid, some water. Okay. Either to take a sip or let it touch your cervical plexus, your neck bone. Okay. So we move on. So now we move to the next thing. We said S stands for what? Skin. And then we said the M stands for what? Muscle. But it's not muscle you find after the skin. All right. What you find after the skin is the superficial fascia. It's a connective tissue. It connects the skin, okay, and the deep fascia. While the deep fascia connects the superficial fascia with the muscle of the thorax. So thorax is simply that region between where and where. Put it in the comments if you are with me. Good. Now, after this session, we are going to run another session, okay, because we are using different styles. Sometimes we teach from material, you see the material, we teach from book. Other times we make you see us, we talk one to one, we don't look at material. Okay. Now other times we run short videos, other times we run tests. Whatever we are going to do is to make sure that you are used to this thing. When you are often seeing something, often confronting something, often faced with a thought, a concern, a concept, that concept, you don't even know when you master it. All right. Look at some of the slang you use, or we use, or people use. It's not because they were born with it. They stay where those slangs are used, or they watch home videos or phone videos or whatever, or they stay where those concepts are used. And if it is a professional concept, guess what? They will think they are intelligent, but they are not. Just that they grow where intelligent people were. That's the point. And if it is a foul vocal language, they will see them as unintelligent, foolish, not because they are, but because they are confronted, confined themselves to a place that they say those things often. Back to work. Iran. What's Iran? And that is I for introduction to thorax. R for what? Region between the abdomen and neck. Iran. I introduction, R region, A abdomen and N neck. Is it not simple? Write it down. Give you a few seconds, write it down. Iran and what Iran stands for. All right, so I believe you must have finished writing it now. So let's continue. The next one I said, we talk about the characteristics of thorax. All right. And then after that, we said we create another acronym now, pick some letters and we form it. I said you can say SSD, TT, TT, SSDMTT. See, now me, I'm struggling because it's not used to me. If it is SMSTTD, come on. SMS, that's very good. I may manage a little of something that is common and what is not common. But when everything is totally uncommon, come on now. You have to come on it over and over again. Do you follow? Yes. It's the deep things that is not told to you. And then when you are done with this class, Don't just say, thank God we are done. Try to think about it. Join the um, MSc WhatsApp channel, okay, and share with it. And then if you don't have access to it, you can teach a friend. You can share who sent the link to you. They have a way of connecting some of our team's study partners across the institutions where they are studying these concepts. Are we together now? Then moving away from there, we said you also have what else do you also have? You also have your your phone. You type it there. You make a recorder. Try to say the things you've learned. Say from book first, then close the book. Try to ask yourself, what did we say is thorax? What did we say are the features? How do I know thorax? Say it's the region between the neck and where the diaphragm is. The diaphragm is that structure, that musculofibrous partition that separate the thorax, that's the rib cage. You know your rib now, the chest, where you people call the heart. Say, are you doing this? My heart beat their chest. Okay, so that's that thorax. Okay. So now it has a skin. There's a skin. There's a skin on that thorax. So we said, are you listening? So we said the skin is what you find first when you are doing dissection. Okay, the skin is what you find first, especially if you are going to cadaver hall. The first place they ask you to dissect is the upper limb, and usually they will give you a region to dissect, place to dissect. Okay, usually from this sternum, that's what divide the chest into two, is called sternum. We are going to see that as we look into this thing further. All right. So now we're looking at the characteristics. Skin first. After that, something that's superficial, facial, deep facial, as if it's yellow, as if it's like rotten, some egg yellow. All right. Mixed with something like white. They are called facial. You're going to see them. All right. Now, after that, you find what? You find the deep fascia, okay, that connects their connective tissue. After that, you find muscle. Remember, in histology, we said histology is all about what? Letter C, letter M, letter E, letter N. Are you seeing how we connect thorax in second in coursework with histology, systemic histology, or first in coursework? Are you seeing it? Thumbs up in the comments if you are seeing it. Are you following? This is what we are talking about. Okay, so we believe that if you study with connection, you connect things. Oh, this is how this thing used to. Even when you are getting angry, do you notice that you make reference to what has happened before? Say, this is how you used to do. This is how he used to do. Every time he does it, he has done it here before. He has done it before. And now we are telling you, you need to be serious. And when people are serious, they are not smiling. They get angry. And the same way you get angry when you are vexing, all right, the same way you get angry here by connecting where you have found that thought before. Do you follow? So in connective tissue, in histology, we said histology is all about connective tissue, muscle tissue, epithelial tissue, and nerve tissue. So in the thorax too, there are these things you find. All right. Now it does not. That's so. If you understand that concept, now you agree with me that this is not the only thing you find in the thorax. All right. There are other things. See, like now I've just mentioned nerve tissue, but nerve is not here. That is to say, there are nerves in the thorax. Of course, they are intercostal nerve. All right. Now, why do we call them intercostal nerve? Because the nerves are found between the costal vertebrae, between the costal cartilage, rather. All right, between the costal cartilage. Do you follow? Yeah. So we move on. Move on. I'm trying to talk this way in such a way that somebody can, if you leave this meeting now, like this is how many minutes now? This is about 19 minutes or 20. If you are called to go and do something and you can say, oh, there's something that person explained in that video I got. And this part can be captured. And what's that part? That as we look at the characteristics of thorax, we said there are so many things you find in the thorax. All right. But we are not considering all, we are picking in piecemeal. Skin, yeah, is epithelium. So, is epithelial tissue. Superficial fascia, deep fascia is what is connective tissue. Muscle is what is A muscle tissue. Now, there's a one they've not mentioned. That is the nerve tissue. This is what you find in between the thoracic cage or the thoracic cavity. So are you seeing how we bring histology of first? That's why when people say, "Oh, I'm not in year this, so I cannot study this. I'm not yet." No, 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 no. If the problem is not a lazy person blames his tool. If you find a good teacher, he can simplify a complex something to a 5-year-old. He can simplify something that took him years to learn in a very simple way. Are you following? Yeah. You see, if we are just here to teach you where they usually ask in thorax, of course, it's simple. They ask the intrathoracic structures or thoracic inlets. All right, they ask you structures that passes through the thoracic inlet, structure that passes, through the thoracic outlet. Those are things they ask. The apex, artery. So that's that about that. Histology is about 4 things, just 4 things: epithelium, connective tissue, muscle tissue, and nerve tissue. Now, in this characteristics, they've not told us nerve is there. All right, they've not put intercostal or interthoracic. They've not talked about anything nerve, but we know that the thorax has nerve. If not, you not feel it. When someone beats you, you not feel his nerve that receive the impulse and then transmit back, returns the response. Okay, we call it feedback. In physiology, when we are looking at it, talk about, oh my God, see, this is good to be a medical fellow or to study medical stuff, because you anatomy, and we cannot fail to talk about another thing in anatomy, and we cannot fail to talk about another thing in physiology. And what is that? Feedback, homeostasis. We have positive feedback, those are feedback regulators. We have negative feedback, we have positive feedback. All right. So let's leave that. Maybe when we talk about that, you know which one is when the response is antagonistic to the stimuli and when the stimuli is in phase, all right, or induces more response. So we'll talk about that when we look at physiology. Next month, August, is when we are starting physiology. We add physiology to this as we are adding head and neck. But from this period, we are trying to see how much we can cover to completely look at the thorax, that's the tap, okay, upper and lower limb. And we are already working hard, seriously about that. Yesterday, we tell you that the whole 48 topic of upper and lower limb, okay, upper limb and lower limb is reduced to 17 topics. We said that. And we shared some mnemonics, okay, to remember those 17 topics. And we said, please never ask very old student question, okay? Many fail comprehensive joint board exams because brachial anatomy always feel challenging. We say what it stands for: popliteal, artery, nerve, organs, venous plexus, and all that spaces, quadrangular space. We talk about those things: muscle, thrash, femoral angle, triangular ring, and all that. All those arches of the foot. Now, and then we move on, and we said, now here we are saying histology. Sorry, the digression, but it's needful. Histology is just, you can talk about the connective tissue. Okay, bone is a connective tissue. Okay, cartilage is a connective tissue. Blood is do you understand? A lot of interesting connective tissue. All right, that's not what we are looking at. We'll have a session for that, but I'm just telling you. Okay, now aside from this, superficial fascia is a connective tissue. So histology helps you understand anatomy very well. So your foundation in histology need to be good. So skin is a type of epithelial tissue. We said epithelial tissue is divided into 2 by classification based on shape and based on what? Layers. Based on shape, we say CIC, that is cuboidal, all right? Aside from cuboidal, we have irregular, we have columnar. So there's the one that look like column, there's the one that look like Mackey cube, and there's the one that's irregular, as in they do yanga instead of shape. Okay, that's that for that. And we mentioned example. I think we have dropped a video on that. I will check. Like we drop a video on that. But we had a session, live session on that. Okay, I'll check either on Google Meet, but we still do here, so the whole world can get, because that Google Meet we didn't record it, we didn't save it, so we only have audio recording of that. We didn't have audio visual. Okay, and then based on what layers, we say we have STS, and I told us, I said, why I said STS, because in my church we do STS every Sunday, so so when I attach that STS now to what I'm learning, it makes it stick longer. Okay, just like when we're doing biochemistry, I remember I was telling those young people, say, okay, you love praying to God to help you understand these 20 alpha amino acids. So what do? It's very simple. God always value love in many powerful true prayers. Saying, thank Christ, trusting God Almighty, a good sacrifice, holy Almighty God. That's what I used to show them, how to memorize the 20 alpha amino acid. And that they understood the 4 different classifications based on polarity, based on acidity, based on essential, non-essential, based. Do you get my point? Based on simple branch, based on, do you get? And that was interesting. And even when we were learning to draw the structure, they were, wow. I said, yes, give me just 1 hour and I'll get you to draw the structure. But the next 1 hour, you have to practice it. And by the end of the 2 hours, me and you leave. And once you are done, you go and teach someone from your brain, not from book, not opening book again, but we learn from book. Are you seeing it now? Let's come back. It's superficial that causes us to be a bit angry. So I was telling you, when you are angry, you make reference. Is it not true? When you are really angry with someone, maybe you tolerate the person, tolerate, all of a sudden you can no longer tolerate. You have to be angry. And when you're angry, guess what feeds your anger? Fuels it. You will making reference, time, venue, in fact. And even the person will be shocked because it's not the person that is angry. That's the same way studying is. When you store, you connect. When you store, you connect. When you study, you connect. Study is not just opening book to read. When you see something you don't understand, you pack 7 books. Okay, check 𝕋𝕚𝕚 anatomy. You check online. And that reminds you, don't study anatomy with Google. Study, because Google can always be wrong. In these days of Pinterest and people upload a lot of things and off, it goes online. These days of AI, and AI does a lot of mistakes. So also we'll be teaching. So let me even write it down. Okay. So I don't forget. I have a page, special book I write some special things down for some special people like you. Okay, so things I'm promising you I'm going to do. Okay, I'm going to make a video. On how to study, okay, anatomy with AI. Because if not, you are going to be getting wrong. Like, for example, I think today someone sent me some muscle because I was teaching someone yesterday night. We were having live session, muscle of the scapula. And guess what? The person sent something. And I noticed where he was dropping teres minor. On the brachium, that's on the shoulder. Okay, sorry, between the shoulder joint and the elbow joint. They label it as the teres minor. I said, Jesus, how can that place be teres minor? As in, towards almost closer to the elbow joint. So it cannot even serve as the incision. So we say, okay, maybe that's the attachment where the end, the tendons attach bone. And tendons, it connects joints. Sorry, it connects bone to muscles. Tendons connect bones to muscles. Ligaments connects bones to bones. You need to write that down. I need to allow that sink in, because you see, it's not easy to recall those things. It can be confusing. So let's get back to work. So we are done with thorax. Now we said thorax SMS TTD. That's send your SMS thoroughly today. Send your SMS thoroughly today. Like I said, comment today. We are getting, subscribe, share this on your WhatsApp status, okay? And then do what? Drop it on your social media handle, this channel. Because like someone said, this is a channel where your concerns and concepts that are confusing in your preclinical days can be demystified. Are we together? So drop your comments. All right, so we are done with Iran. We said Iran means introduction to thorax. The R there means region. The A there means abdomen. The N there means neck. You see, now I'm talking fast, but when we were building the pneumonia, we were talking slowly. And we allow it to sink in. Are you seeing it now? Thumbs up if you are with me. Come on. Drop in the comments. Like, share, send to someone. Okay? And you see, some people say, I wish I had seen this when I was my preclinical days. Why not help a junior colleague? Why not help someone who may not even be medicine, but is studying the course? Okay, why not help a life? Send, share. And guess what? There's nothing as fulfilling, as successful when it is because of you, someone is smiling, or someone have a sense of relief, someone is happy, burden is lifted from the person's shoulder. Okay? His mental health is improved upon. Are we together now? So send the link. Okay, so it's not about, oh, subscribe. No, it's about reaching out to people. You may not be able to do what I'm doing, but you can be a connective tissue, like superficial fascia connecting the skin, epithelial tissue with the muscle. Come on now, with the deep fascia that connects with the muscle. Okay, you can be that. You can be a helping hand. Thumbs up if you are with me. Okay, so SMSTTD, that is S for skin, all right, and then M for muscle, and we told you muscle is after the connective tissue. CMEN. That CMEN means semen. Oh, each time I see a man, I see men, I see histology. So the whole histology is round up in that. All right, what does that mean? Histology is a study of tissues. And as we talk about tissue, tissue is what? Is a group of cells that have similar function and what? And shapes. And guess what? There are different four different types of tissue. In some organs, you can find two tissue. In some organs, you can find, so when you have a collection of this tissue working together, it forms an organs. Are you getting me now? So now we move on. We said this tissue, even though we say CMEN, the one that is number one is epithelium. All right, epithelium. But when we say CME, and that's why if you check what we said C is number 2. All right, M is number 3. E is number 1, N is number 4. So semen. Are you getting it now? And semen, some vocal people know what else that stands for. Yeah. Have you ever heard that sound before? Semen or semen. All right. You know what you're thinking and you know what you're saying. But here what we are saying is that's for histology. All right. So histology helps you understand your anatomy very well, just like embryology helps you. If you see an embryology facilitator or professor will tell you, knowing when an organ was formed and knowing where it was formed helps you to appreciate regional anatomy. All right. The only thing you add as a clinical or pre-clinicians is clinical anatomy. That's why as you introduce anatomy, you must find the clinical scenario. What will make that person to bring that anatomy, that structure, that region to your clinic? That's clinical significance. Do you follow? So we have overtalked this thing. So epithelium, connective tissue, muscle tissue, and what? Nerve tissue. All right. So it's between the thoracic cage, that's the wall of the thorax, that's the ribs, and the thoracic cavity, that's the potential space. All right. There's space between one rib cage or thoracic cage and another. Why do we call it cage? Because it's intertwined. It's intertwined, something like this. Okay, let's put it this way. You can see that pin, that biro intertwines it. Okay, although that's a miniature picture. Okay, so moving away from there, we said now we have done 30 minutes and we are still on this, still on introduction, still on characteristics. And you see, we've talked about histology now. So it's not just this, we've talked about a little of histology here. Are you following me now? Yes. And epidermis is example of what? Dry keratinized, okay? Dry keratinized, stratified squamous epithelium. Yeah, because if you look at epithelium, we said STS, and the S is what? Simple squamous epithelium. Okay, simple. The T is transitional or urogenital epithelium, epithelium. Okay, uroepithelium. Then the other S is stratified. The stratified is stratified squamous epithelium, stratified cuboidal epithelium, stratified columnar epithelium. Whereas the simple is simple squamous epithelium, simple cuboidal epithelium, simple columnar epithelium. Remember, see the difference? Now, in transition, it's not like that too. Transition is just like that, okay? It's just transitional epithelium, right? Because it transits and it's found in urine. That's when the muscle relax, okay? You relax, like the ischio-cavernous muscle is is what pushes the penile urethra, is what pushes the male genitalia up during the blood running there for erection or during urine excretion, right, during a terminal end of GIT. So moving away from there, we now said that this is all about, I wish we just end here for me. I wish we just end this here and go and say, what did we learn today? We have learned Iran, and we have learned what? SMS, TTD. You know, some people carry phone and they are doing SMS, they are pressing as if they are oppressor. They are pressing the phone. So they were pressing SMS, pressing, chatting in Snapchat, in chat, WhatsApp chat, and all those chat. And as they are chatting, also tell them to add to comment, add this one to comment on this one too. Okay, but that's the point. All work, no play, make Jack a dull boy. You getting it now? But all play, no work. What will it make Jack? I leave you to fill the gap. So we move on. So we are done with this. We are done with this. For me, I want us to take 5 seconds to 1 minute break. All right. And then you pause on your own. Pause the recording if you are playing back. All right. And if you are here with me live, guess what? You pause as I'm going to pause now for 1 minute to 2 minutes and ask yourself, what is thorax? I've told you thorax is Iran, I-R-A-N. What does I stands for? Introduction. What does R stands for? Region. A stands for what? Abdomen. I showed you abdomen. We are still going to work more so you get this. Okay. And then A stands for what? The N stands for what? Neck. So it's the region between the abdomen and the neck. That's all. Between the abdomen and the neck. That's the thorax. That region. All right. Now we now talk about characteristics. We said if you are dissecting thorax, you cannot dissect thorax if you don't dissect the skin. If you don't cut through the skin using your scalpel. We're together now. Yes, after the skin, you see something like yellow, very irritating. That kind of thing you see when someone have a large injury on the surface of the skin. It looks yellow, some whitish thing, mixed with it. Those are adipose tissue. Are you getting it now? Connective tissue. All right. So we move on. It's say when you scrape that off, you find deep fascia, still connective tissue. When you find that you now see something like red, as if it is meat. It's not different from the animal meat. The only difference is that this one is human. Okay, it has a brain that can think. All right. So now, how's that? After you remove them, and there are a lot of interesting muscles there. All right. I don't want to stress you with the names. A lot of muscles there. Okay, like the chest. Okay, like yesterday we did about 17 muscles of the scapula. I'm going to send that video to the unfailing before the night session. Okay, now you see that the scapula have 17 muscles, and we use the mnemonic 𝕊𝕤𝕤𝕤𝕚. Try studying. They learn really raise surgery plus difficult test. Busy tutor come late often. 17 muscles of the scapula. That is supraspinatus. Okay, let me write so that I can call it, because you work with your biro and with your book. Just before we pause and you tell us, you write on your book and you say with your mouth, what is thorax, introduce thorax, and then sketch a thorax if possible. This is a sketch of a thorax. Okay, something like letter C, and then something by this side, something by this side. Okay, this is even telling us the diaphragm. That thing that is red, that's the diaphragm there. Call them thoracic diaphragm, because there's another diaphragm, that's pelvic diaphragm. Are you getting me now? A lot of diaphragm. So we're going to enjoy this diaphragm. So that's the sketch. Okay, you cannot talk about anatomy without diagram. So you say I, D, C. The D there is the diagram. The C there is the characteristics. Okay. So as we talk about this thing now, what do you say? You say we're talking about centimeters of scapula before we come to this, the diagram of the thorax. Okay, diagram of the thorax. You can see that now. Okay, so we said 𝕊𝕤𝕤𝕚, try studying, they learn really surgery, plus difficult test, because busy tutors come late often. That's how you learn something. Okay, as that I learned this thing when I was in my clinicals. Okay, that's how you learn something and you master it forever. So when you learn it, you ensure you reach someone else, share it with somebody. What you don't share, you don't earn. In fact, the secret of gaining is by giving. So a cup cannot be twice full if it does not share. So how can you fill a cup over and over? When you fill it, you share. When you fill it, you share. When you fill it, you share. So as we are filling you, you share. Just like now we've done thorax and characteristics. When we are done with that, what do you do? Before we go to composition, can see composition of thorax? STP, and you've heard STP before. I didn't want to be in a hurry. I feel good coming to share this thing with you. You're going to enjoy this channel. Let's take it little by little. And whatever you take, share with someone. Okay, not just because of the exam's sake. Yes, I know some people are here because of the exam, but guess what? Much more than exams, you enjoy yourself. Okay, you understand. Okay, why someone should not play with the chest. You see children playing with the chest because of the delicate organs there. Are you getting me now? You don't joke with it. You say, carry knife, not choke me now. No, you don't do that. You don't play with. That's why they say keep some things away from kids. All right. People don't have what is kid? KID. They don't have knowledge. They have no knowledge of the inconsequential decision they make. Okay. So that's why they are called kids. Okay, so we said yesterday about 17 muscles of the scapula because I gave them outline for studying any muscles. There are so many of them. Outline for studying many we're going to do that live again. No. It was in Google Meet we did 17 muscles of the scapula. For yesterday, we did only anatomical topics. We did bones, we did joints. So maybe we are going to repeat upper limb again this night and we look at muscles and 17 muscles of scapula and other muscles of the joints and bones. So as we are studying joints and bones, we also study their muscles. Muscles is the most difficult aspect in upper and lower limb and general in anatomy because there are a whole lot of them. Okay, so now we move on. We said silly intense try study. They learn really surgery plus difficult tests because busy tutor come late often. Now when we're internalizing, I don't rush fast like that. See, when we're internalizing the meaning of thorax and the characteristics, we didn't rush it. We take it slowly. So this one now we are here again, and I said for me to list it to you, I need to write the mnemonic exam to help me recall it. So silly stands for supraspinatus. Intense stands for infraspinatus, and then how do you call this one? Silly intense. Tri stands for teres minor. Minor comes before major. Okay, C minor first before major. Usually minor is usually above, major is usually below. Okay, and then this other T, this S here is subscapularis. This other T is teres major. This L is levator scapulae. This R is rhomboid minor. Okay, or you can say rhomboideus minor. The difference is Latin and Greek. Do you follow? Okay, I'm not expecting you to write it down. Don't stress yourself, except you pause this session in bit and then we are going to run a session for this, or we may cut the short of this and run as this thing. Okay, but the way we want to do in scapula is, if you are talking about this, we show you the diagram. Okay, the part where the muscle is, you see the arrow. All right, because how you study anatomy is by using structures, or you use pictures, either structures or picture, to be able to capture what you capture. You can say and add your own explanation. That's why you don't study anatomy like this one. Is just background build up. Do you follow? Okay, that's why I'm on my video, so you can see me eye to eye. Okay, and that's why sometimes when you see me drop those thumbnails, say, wow, can you see the secret to master it? And we like, wow, sometimes I remove my lenses because it's amazing thing. Do you follow now? Okay, so we move on. Okay, so silly intense time studying. So silly is for supraspinatus, intense is for infraspinatus, and then tri is for teres minor. Okay, study is for subscapulary. Then this one is the len is for levator scapulae, and this for rhomboid minor or rhomboideus minor. Then the other R, ray is rhomboideus major. Okay, then one is serratus anterior. This one is pectoralis major. Okay, there's no pectoralis minor. Okay, that attaches to the scapula. Then after that we have trapezius. Trapezius is around here. Okay, don't worry, you're going to see all that. And then you see the bicep brachii. Okay, that thing people do their hand like this and say I have muscle. So that place between the shoulder joint anteriorly or in front. Oh, someone say which one again is anterior? Don't worry. We're going to look at terms, classification of terms and joint. Is a topic in one of the 17 topics we did. We're going to look at that short. But I'm just bringing small thing in here in some lower limb so that friends who are doing lower limb and colleagues who are doing lower limb will enjoy themselves. Okay, so another one is tricep brachii. That is tri. And then the other one, all right, so let's continue. We needed to pause so that as usual, I will, so we move on. Now we talk about, we were still talking, listing the muscles, and we said, brachial, BZ stands for bicep brachii, the muscle in front of your humerus. Okay, humerus is the bone between the elbow joint and the shoulder joint. That's the humerus. Okay, so now we said the muscle in front of that, when people do their hand like this, as if they are Jackie Chan, as if they are actor, as if they are, okay, Arnold Schwarzenegger. That's the actual name of that actor. You know, actor was a great fighter, things like that and all that. So that's by the way. So we move on. That's now the muscle at the back of that, opposite of that, is called tricep brachii. Okay, all right. You are going to know why it is called tricep. You're going to know why, but not in this video. Okay. Now, we talk about coracobrachialis. Coracobrachialis. Okay, so meaning the muscle is found in the brachium and also in the coral area. That's where the heart is and all that. So we move on. Talk about the 𝕊𝕒𝕤𝕤, the neck muscle, and latissimus dorsi, the climbing muscles, is the muscles that cover the whole of our backs. Call them climbing muscles. Okay, it climbs around this axilla at the back and all that, a bit into the axilla. So, and teres major, teres minor, okay, all right, overlaps them, just like the gemelli brothers. Okay, the superior gemelli muscle, inferior gemelli muscle lapping between the obturatus internus in the lower limb. So that's how this one is. That's why we call latissimus dorsi the lady between the two major. Okay, the lady between the two major. Okay, because oh, sorry. I just said what? Sorry about that. I just said that before we continue with components of the thorax, we have finished introduction to thorax and characteristics. So I want you to take a few seconds. Pause this video, take a few seconds. That's if you are live, you pause as I'm going to pause for a few seconds. Write it out. What have we learned so far, especially about thorax? Forget the other ones that we used to help you understand or to help you appreciate. Do you follow? Okay, just as you learn about introduction to thorax, okay, we learn about the tissue, the superficial and deep, SMS, TTD, learn about Iran. Okay, that's just the two things. So let's pause and then do that. Write it out now. Okay, before we talk about another two things now. All right. Okay, so I believe you must have done that. Thorax, we just learned two things about thorax this moment. Okay, number one is introduction. We use the acronym IRAN, Iran or Iran. The second one is we said SMS, pressing button, SMS what? TTD. That is for characteristics. We said Iran stands for introduction to thorax. Okay, region between the abdomen and neck. Simple. Thorax T equals to what? In fact, Tiran. Okay, let's not add that. Okay, let's stay with what we know because repetition brings retention. By the time you want to learn something new and you want to improve, that's why they say practice does not make perfect, it brings improvement. So that will make sense, isn't that right? So as you keep practicing, as you keep pronouncing, as you keep saying this, guess what? It begins to make sense. All right. So we move on. Okay, I want to talk about the next thing now, which is component. Okay, IDCC. So we have done introduction, diagram, components, characteristics. We are entering components now. We're entering components and then we'll enter extent. We enter extent. All right. After that, we'll enter inlet. After that, we'll enter function. In fact, that was how we said theme. Film. Film. C. Jake. Film. C. Jake. Okay. Film. That's FIM CJEC. Film. C. Jake. I'm going to say that in the other way around. C. Jake. Film. C. Jake. Okay. So Jake. C. Film. It's just like saying Jack. C. Film. All right. No, there are some people called Jack. Each time Jack see film, his mind is not there. Okay. So for me, like I told you, you must understand. It's not just a question for me because I'm going to say, me, I don't learn with that thing. The reason because you've not known how it is used. If you know how it is used, you will use it. And the truth is, you must know how medicine students study. Okay? Practice it. Today you can go by and write, but they practice holding that your hand to write over and over and over till you can learn it. Now, if you start learning with the left hand now for a time, practice before you know, your right hand will feel lazy and does not know how to write again. Not that it cannot accept you, but the left hand will begin to master the art of writing with its left hand. Because what you do over and over, 21 times, you space it. 21 times is a science. It's 1 times. Okay? You find a distinction student in anatomy or distinction student in physiology, they'll tell you if you are in anatomy, they don't joke with teaching, they teach. Okay, pick those things they get. You see the way they play with cadaver, they borrow the phone, the bones, and the structures, and those synthetic and non-synthetic, and all that they build their business, their dream. Now you talk about the physiology student, someone don't, they tell you flow charts, and that's as we are building histology and this anatomy. We take that style. You flow chart, you get it. All right. So when we get into something else, it will not be bad. Do you follow? Okay. So then come to IDCC. What is IDCC? Introduction for I. D for diagram. Okay, see the diagram, thorax, okay, region between the neck and the abdomen and the neck, or neck and abdomen is the same thing, the same English. Okay, yeah, find a way of figuring it out. All right, then IDCC, I for introduction, D for diagram, the first C for characteristics, the next C for components, okay, and then E for extent, and then I for inlet, and then F for what? Function. So we call it Jake C film, all right? Jake C film, or you say Jack C film. You know, there are some people when they see film, their mind is not here. Maybe like in some sub-Saharan region of Africa, if they see light, okay, not everybody, because there are some people that light is 247, they have solar and all that. But there are some people when they see a light, you know, light as in electricity, guess what? Their mind is not there. They are agitated, and they are vibrating, either pump and dump, bowel or bucket and bowel, you know, and that's the movement of the thorax, always moving because they have seen something. You see how we're connecting this? Don't worry, we'll soon see mechanism of respiration. And you also see both in anatomy and in physiology. And if you are not, that's not anatomy very well as we are pushing it. When we start looking at physiology, to make sense. So what you didn't really get here, when we are doing it, another thing, it makes sense. Okay? Thumbs up, you are with me. So Jake C film, that's the first thing you want to do. If you can do that here before 1 hour gets there, we'll be fine. Okay, 1 hour, 1 hour 30 minutes, 2 hours. Okay, yeah, because if you understand something, if you fall in love with the concept, guess what? I tell you, guess what? You fall in love with the concept, you understand the concept, you will not want to miss the video. Okay, because of the way this person was talking, because the way it was arranging, so that you're making it interesting. That's why we say, let's do this live. And we'll be doing live. Now I'm doing live with sharing screen. Another live I'll do will be one-on-one. I invite a guest, we talk, all right? While others who are live, they are enjoying the chat and comment section and the subscribing session. Okay. Well, another one we do is we are going to see different ways of getting this thing done to make sure we get the burst of this thing. See this anatomy, it will be in your fingertips. If you can touch your skin, then you can touch anatomy. So that's what we mean at your fingertips. Like now I've told you, anatomy of tap is thorax, your abdomen between this and that's all. It's not much, not difficult. So it's when we try to internalize the small things, those interesting words, like here's something costo-transverse joint, you know, costo-vertebral joint. Here's something like here's something like synchodrosis. Okay, it's this type of joint. Here's something like sternal joint. Okay, that's the xiphoid process and the sternum. they join between them. Yes, so you hear a lot of funny things of join. So that's just what makes anatomy interesting, filled with stuff. Okay. Okay. So we are here still talking about thorax, right? So I believe, sorry for that little break in glitch. Okay, so I believe that if you have checked what we have done before now on thorax, what we've said so far on thorax, we said that thorax introduction, IRAN. Thorax diagram, you should be able to see the diagram, can draw something like a circle up and down, see the way it is, okay? And then something like cage, circle, and all that, just a sketch, okay? And you practice with sketch until you are scaled up, right? Your structural appreciation, okay? So now we now said, so if you are with us, if you have gone through, if you've been with, if you have not, go back to what we have said so far on thorax. We said thorax, because it's one of the topics they teach in second year in medical school. Sorry, yeah, in second year in medical school. That's your first preclinical year. The second year in university, the first preclinical year. All right. Usually second semester work, but sometimes they can teach it earlier in first semester or teach it into that's earlier in first semester year 2, or they can teach it into first semester year 3. But that's not what our focus is. Our focus now is, we said thorax bar, we say number 1, introduction. Okay. Number 2, diagram, can sketch something. Okay. Number 3, characteristics. Right. We've done those 3. And the next one we're about to do was the composition, okay, the function, okay, the extent, okay, and possibly we may talk about the inlet. All right. So that was when we now said, let's bring out acronym. JEC, C film, that is JEC dash, that's hyphen. Letter C, another hyphen. Then FIM. What does that mean? The M stands for meaning of thorax. That's introduction to thorax. Are you seeing it now? That Iran. Good. The I stands for the inlet of thorax. I see now we are going to talk about inlet, thoracic inlet or inlet of thorax. Okay. The F stands for function of thorax. You're going to see the importance of thorax or thoracic cage. Done with FIM, FIM, function, inlet, and meaning of thorax. That meaning is the introduction. Although some people can introduce thorax and still write the meaning, no problem, to increase your outline for answering question. But if you don't, those are basic points, right? I know there's a class of people say, oh, in our school, you must write like 20, 15 subtopics when you're writing about a certain anatomy. No problem. Okay, but there are some basic things you should know as a medical student. Remember, you're a clinical student, not anatomy student. All right. So there are just some things you should know, right? But as you know those things over and over, you see the need and the interest to know more things anatomically. All right. So C then talks about characteristics of thorax. F was for what? Function of thorax. I is for what? Introduction of thorax. M is for what? Sorry, I is for what? Inlet of thorax. M is for what? Meaning or introduction to thorax. Now, JEC is spelled JEC. This C is for composition. The E is for extent and the J is for joint. JEC, C, film. That's what we learned today. Okay, putting it down to JEC, C, film. That's what we learned today. JEC, C, film. JEC, C, film. Okay, so JEC, C, film. Right, I'm trying to check what that feature is for. We are still learning. Are you getting it? So we are still learning. So with time, we'll get to know how all this feature is a new thing, and we are okay. Sometimes you learn and oh, this is not the right way of doing it. Okay, this is not the best of. So we are still learning. So while we are learning to use this media to study, okay, we are also studying our book. You get okay. So JEC C film, that is capital J, capital E, capital C, hyphen, capital C, then FIM. That's the first thing we are looking at. So we have looked at the meaning, which is Iran, that is introduction to thorax, meaning is a region between the abdomen and neck. Neck and abdomen, abdomen and neck, neck and abdomen, abdomen and neck, neck and abdomen, abdomen and neck. Okay, so we move on. We said the CD is characteristics, and we said SMS TTD. That send SMS till send SMS thoroughly today. So someone take time to text the SMS. And the S we said is for the skin. After you cut the skin, cut through the skin, you find fascia, superficial fascia, deep fascia. Okay, after that, you find muscles. You find a lot of them. In the chest, you have the chest muscle, pectoralis. Okay, you have the chest muscle. Okay, you also have other muscles, all of mesocoracle. You have a lot of muscles. Okay, right. Even still, you see the chest, you find the scapularis. Okay, subscapularis under the scapula, still the thoracic. You have a lot of these things there. Okay, so aside from that, we said you have the nerve, and I use the concept of histology to explain this, so it will stick. I said histology is about CMEN. That is connective tissue is C, M for muscle tissue, E for epithelial tissue, N for nervous or nerve or nervous tissue. Now E is epithelial tissue. That should be the number one. But for ease of recollection, are you following? We say semen, 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 whichever way. Semen, you heard semen before reproduction, semen, okay? Men release semen, okay? All right, semen. So that's why it's histology, named after a his, not a histology. Histology, okay? So they use the relate it that way and be a good. So that's another thing in anatomy. You learn using some of these things. All right. So we move on. We said those are the three things you've learned. The diagram, look at the diagram. You can sketch that. Just a C here, opening here, something like this. Something like this. I don't know if that's clear. Is it clear? Maybe you cannot see, but you can see this on the book. Okay? Something like that. So we make one and show you on book. Okay? All right, since that is not clear. So we move on. We said we now want to look at, we've done meaning, we've done characteristics. Let's do function and the inlet. Okay, let's do function and the inlet. So, but before we do the function and inlet, let's do composition, because on the slide that's what comes next. Composition, you have STP, standard temperature and pressure, right? You heard of that before in chemistry, right? Good. You're going to hear again about chemistry, standard temperature and pressure. But now, what we are looking at, S is for sternum. Look at this bone. It's called sternum. This bone. It's called sternum. See? It's called sternum. Okay? That bone. It's called sternum. It's called sternum. Where this thing is, the xiphoid process is. You can see xiphoid process of the sternum. You can see? Okay? See where the xiphoid process of the sternum. This xiphoid process now of the sternum. Okay, you see it and you find the xiphoid. So from that place to the mandible. Okay, mandible of the sternum. You can see the mandible. Good. From that place now, that xiphoid process to mandible of sternum is called sternum. So, or sternum. Okay, so those structure there is called sternum. The middle part is the body of the sternum. Okay, so that thorax now is made up of sternum. All right. The next thing is made up of is thoracic vertebrae. You can see it here. Thoracic vertebrae. What's thoracic vertebrae? This thing here now. You can see. Can see. Can see this place now. See what it is called. That's what we call thoracic vertebrae. Eh? From 12 thoracic vertebrae to the first thoracic vertebrae. That's what we call thoracic vertebrae. Are you following? Good. So you now see what it is composed of. When we say sternum, you see sternum. When you say and that's how you study anatomy. If you want to read anatomy, go borrow bone, or you borrow bone, or you get atlas. All right. But this one has been. These are pictures in this material now of this lecture has pictures. See, prepared by Dr. Anita Rani, but I'm the one delivering now, okay, because we are storing, okay. Although he was the first person to deliver, I saw the data. So this man, we really appreciate this work, okay. We recognize this work. We are trying to internalize. Remember, our aim in this channel is to do what? Is to internalize lecture note, lecture audio, lecture PDF, lecture printer, lecture concept, and all that. Past question and answer and all that. That's what this channel is, and that's a serious work. That's why sometimes I'll take break, take shots, take recess, take some water like this. So we are here again. We said that's about that. So we've talked about JEC CFIM. That's where we started from. We said M stands for Introduction to Thorax, IRAN, and then the next thing we look at was diagram of thorax. Can see is the rib cage. Thoracic cage is the rib cage. So thorax is that region between here and here, abdomen, and that's Iran. And then now we talk about the characteristics. Said SMS what? TTD. The person presses SMS till thoroughly today. Yes, press SMS thoroughly today. So SMS TTD. SMS TTD. Text message now. Good. And then now we are looking at another thing now. Looking at thoracic composition of thorax. As you talk about thorax, that's what it's made up of. If you don't study with outline, it will be difficult to memorize them. It will be difficult to recall them. So to enjoy your mental health and memory, so you have time to just think you understand it this way. Okay. Now see how much we take time to internalize this concept, all right? And then see the time we need to put. So to store takes more time than to retrieve. Takes more time to store. Just like when they are programming a computer. Take more time for the software to store. But to pull it out is very fast. Are you seeing the mechanism? Good. So now STP. What is S? Sternum. What is P? Sorry, STP. What is T? Thoracic vertebrae from the first to the 12. Okay. And by way of recalling, in your first in course, what they'll teach you spinal nerve, and we're not going to do that. Spinal nerve, we said to remember the spinal nerve. Sorry, to remember the spinal cord, we said Christ the Lamb sacrificed completely. Christ the Lamb sacrificed completely. Now, Christ is usually 8, okay? And then D is usually 12. L5, L5, C1. Let's see it now. Christ the Lamb sacrificed completely. Okay, so now we said, watch this now. We said this Christ the Lamb sacrificed completely is Christ stands for cervical vertebra, or cervical, where the cervical nerves emanate from or emerge from. They are remains. Okay, and then L is for T is for thoracic vertebra, where the thoracic nerve comes up from. And then L is for lumbar, where the lumbar vertebra, where the we have L1 to L5. While T1 is T1 to T5, so they are 12. Okay, then the Christ the Lamb sacrifice. S is the sacral vertebra, or the sacrum. The C is the coccygeal vertebra. Okay, so that's what we are talking about. So that's how you build it small, 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 small. So I also do short mnemonic on this to help you remember the spinal nerve, okay, or the spinal cord, or the spine. How many are there? Number in 31. This is 10. Okay, and this is 20. Came from 20, so it's always 31. Yeah, 31. That's 31. Okay, so we move on to another thing. What do we move on? We say Jack, C, fin. We've done M, which is JECCFIN. JECCFIN. Okay, JECCFIN. We've done M, which is meaning. We've done C, which is characteristics. We've done C, another C now, which is components or composition. Composition, ST. And the P is the pairs of rib. Okay, pairs of rib. There are 12 pairs of rib. Now, maybe in another material, not this material, we are going to see types of ribs. We'll see types of ribs. Okay, we'll see types of ribs. So it's not this material. Look at another material. We'll see types of ribs based on true ribs, false ribs, based on tactical, atypical. Okay, and all that. Okay. So that's that. All right, let's move on. Let's move on. We said we have started around 2:30. This is around 4 o'clock. From 2 to 3 is 1 hour. From 3 to 4. From 2:30 to 3:30 is 1 hour. From 3:30 to 4:30 is 2 hours. So we will not do 2 hours. Okay, we are going to stop maybe 1 hour 30 minutes. Okay, and we go. Okay, 3 to 4 is 1 hour. 4 to 3 is 1 hour. 3 to 2:30 is 1 hour 30 minutes. Okay, so we're going to do a little bit into 1 hour 40 minutes, or even 2 hours. You nice, you study for 2 hours. Study for 2 hours. It pays to study. You need to study. It costs to study. Okay, if you study, you'll not be stuck. If you are reading, you'll be ready. Okay, you can't be ready if you were not reading, and your why in the ready is what makes you read. Another usual way of study. Gone are those days say, read in your mind everywhere it's noisy. You must bring out your voice to counter the noise. If not, you'll be a noise and not a voice. Okay, a lot of distraction. There's no cool way. In fact, if you are so focused, you sleep off. That's how the brain is wired. So you need a level of peace. That's why sometimes you make it when you have challenges. Okay. Okay, so we are back again. We've talked about 4 things now. The meaning of thorax. It says the region between the neck and the thoracic diaphragm. And you see the thoracic diaphragm as you've captured it. So you're not cramming, you are capturing. All right. Next one, we've done the characteristics of thorax. We said it is SMS TTD. All right. The person sends SMS thoroughly today. What is S? The skin. By dissecting, you cut the skin first. Okay. Next, you find the superficial and deep fascia. That thing that looks yellowish white, as if it is somebody is having injury. Like, it's disgusting, right? But it's the superficial fascia. That's the adipose tissue. Okay. Connective tissue. You have the superficial, you have the deep. After that, you find the muscle. There are a lot of intercostal muscles there. A lot of interesting muscles. External oblique muscle. You have a lot of beautiful muscles there. Okay. And then after that, you have the thoracic cage. And the thoracic cage. After the thoracic cage, you have the thoracic cavity. Thoracic cage is the ribs. Thoracic cage is just the ribs, the protector of that chest. Okay. And the cavity is where the potential space where you have the lungs and the heart. Okay. Another neurovascular bundles and vessels. Okay. So you appreciate that very well when we are looking at abdominal vessels. Okay. Abdominal vessels. So you see the vessels from the heart going to supply structures in the abdomen. Structures in the abdomen. You see it now? Yeah. Okay. So we move on. Move on. So we now also have the characteristics. We are done with that. And the component we said is STP. That is sternum. All right. Thoracic vertebra T1 to T12. And that's thoracic now. Christ the Lamb sacrifice completely. Christ stands for cervical vertebra. D stands for thoracic vertebra. Lamb stands for lumbar vertebra. Sacrifice stands for sacral vertebra. And then completely stands for coccygeal vertebra. Okay, so that's that. C part of those things. You can't do thorax tap without a lower limb. You can't do lower limb without this. So both is interesting. Then we're moving away from there. We also have extent. What is the extent of the thorax? The thorax extends from, look at it now, from this point now. The thorax extends from the superior mediastinum. Okay, it extends from the superior mediastinum, okay, all the way through the inferior mediastinum to posterior mediastinum. You know, in the foregut, they say what's the functional anatomy of the foregut? The foregut starts from the mouth to the end of the first part of the duodenum. That's what we call extent, from here to here. GIT start from the mouth to alimentary to the anal canal. That's alimentary canal. So that's what we call extent, from where to where. From here to here. That's the extent. Maybe from here to here. All right. Can be from lateral to medial, can be from posterior to anterior. Like we talk about the radiographic images of the abdominopelvic region, said AP. Sorry, AP. Anterior to posterior. Anterior to posterior. And then it could be posterior to anterior, depending. All right, so we move on. They're still connecting. So we are done with the extent. Is from where? He said SIP. So the meaning is Iran. The characteristics is SMS TTD. The content is STP. The composition rather is STP. The extent is SIP. What is SIP? Superior mediastinum, inferior mediastinum, and posterior mediastinum. What are the components? STP, sternum, thoracic vertebra, and the pairs of rib. How many pairs of rib? 12, from T1 to T12. 12 pairs of ribs. Okay. Now we are done with 14 now. 1, 2, 3, 4. Okay. The next we want to look at is the joint. Can we look at joint or look at function first? Let's look at function first. Function of the thorax. Look at it. The role of thoracic cage is what? Protecting abdominal viscera. Have you seen why thorax and abdomen are interconnected? Because the thorax, okay, is that region. But the abdomen has some structure. You see it now? Liver, pancreas, stomach in the abdomen. Okay, so a part of the stomach is inside the thorax, while a part of the stomach is towards the abdomen. You can see this thing you are seeing here now. You are still seeing it here now. Are you seeing? You are still seeing it here now. Sorry, you are still seeing it. Are you seeing? So radiographic shows the skeleton. So as you are picturing the flesh on it, you also picture the skeleton. All right. We're making progress. It's 1 minute past 1. We'll soon end this session so we can meet again by 6 to continue. Take a break, you come back. All right, that's Pumuru method for you. Sedentary is not good. Okay, so we are done with what? The extent. We are done with from superior mediastinum to through inferior mediastinum to posterior mediastinum. Okay, and then Jake Siphon. Let's look at the function. Function is what? To protect. That's all. To protect the abdominal viscera. To protect the abdominal viscera. To protect the structures in the abdomen. Protect abdominal packs. SIP STP, SMSTTD, PAC, Iran. Are you seeing now? You're speaking in acromia, like when you talk about embryology, you said acromial what? Acromial reaction. Okay, so we are here again. So we are still talking. We've talked about so many things today. And once you reach 6, because the brain can take 5 to 10 things. All right. Now, if you can take 10 and above, if you notice, if you're in class, you understand the first few things. After some time, you are gone. It's only the lecturer that is enjoying himself. So it's now for you to use the power of recording. I've even told you now, one of the ways to learn is by recording. In case you were not there in previous session, you record your class. Okay. That's why we are using YouTube, so that it can be recorded. Right. What we are teaching can be recorded. Right, someone who was not able to join the afternoon session, morning session, or whatever session can capture it. If we use the other ones, we will not be able to record. Sometimes it costs us so much to record. All right, so let's move on. Now that we are here, now what next do? We talk about the joints. Okay, let's talk about the inlet, thoracic inlet, quickly. We should have talked about the joints, but the joints are Mu. Okay, they are Mu joints. So let's talk about thoracic inlet. That is structures that passes through the thorax. Thoracic inlet. Look at it here. Thoracic inlet. Okay. So as we talk about thoracic inlet, we said we have things that passes through the thorax. Okay. Wow, it's already 5 minutes past 4. We can't take this more than this. We are going to pause here. We'll come again. So we said JECCFIM. That's the summary of what we've done today. Jack Siphon. Jack Siphon. You've heard of that word before, Jack. You know where you heard it? Oh, he's a Jack or Jack. The spelling for our Jack is JEC. Are you following? JEC. Jack Siphon. Now, J stands for joint. You have two major, not really two major types there. It's you can start that way. Jack Siphon. We have I mentioned two here. Okay, I mentioned two here. That is coastal vertebra and coastal transverse joint. Okay, coastal vertebra and coastal transverse. There are about 6 or 7 types of joints. There are more joints. So look at them again. So I don't want to stress us. You internalize that. Now, when we come back again, maybe an hour's time or two, okay, you're going to see maybe this is 4 o'clock. We spend 1 hour, 2 hours to do one or two, cook and eat in 2 hours. Come back again by 6 p.m. We start um, thorax again. We still look at thorax again. But we may be looking at thorax with upper limb. So we look at upper limb a little, lower limb a little. That's maybe the bones, the joints. Okay, we have rehearsed, we revise the mnemonics again, and then we look at these muscles scapula, muscles of the scapula, then maybe muscles of the forearms. We still try to generate something. So we pick a little of that, and then we come back to thorax again, check, see film. Are you getting it now? That way we are storing this, so that if you're in year 3 and then you remember some things in year 1 and you go and write your exam. If you're in year 1, as you are teaching you do this first in-course work and second in-course work, this thing is accumulating. So when your lecturer comes and is singing some of these songs, telling you, we have superior mediastinum, inferior mediastinum, posterior mediastinum, you say, that is SIP now. So as students sip Gary or sip their cornflakes, they sip their Gary, sip their cornflakes. That as you are eating, you are remembering anatomy. You don't understand. That's why we said you master it, you learn it once, you store it, you remember forever. This is the hack. This is what they don't tell you. This is how you come. So whatever you're doing is anatomy. It's muscle that make you to move here. As you are breathing, your thorax. Are you getting it now? This is so. I'm beginning to round it up. I'm beginning to wrap it up. I'm beginning to rush it up because we want to end it here and then make it interesting in the next session. Don't forget. 2 hours time we are coming back. That's by 6 o'clock. By 6 o'clock, the link will be on again. We come. This time we're going to make it. We're going to invite a guest. Okay, it's going to discuss this. Is that okay? So that's it. So the next session is going to be we invite a guest to join us. Okay, I talk like that. Okay, and then when we are done with the first 2 hour session, we'll do another one by 9 p.m. So it's going to be from 6, 7, 8 to end, and then 9 p.m. we start another one 9, 10, 11, 10. You have to take your own personal work, like that. So we work, rest 1 hour, work, rest 2 hours, work, and then by the night you're going to say something that you rest, eat, rest, so you work, you rest, you eat, you work. See, food will not be interesting and rest will not be interesting because you're not. And now this other you can not take in your and it will not allow you until you do what? Until your feet is on the ground, you are alert. They should not mind whatever you say. So you take 2, 3, 4, 5 persons to wake you up. Calls and use to wake up. They must be measured in place. So bring out a treasure from a pressure. Are you getting it now? If there's no pressure on the orange, no juice will come out. If you want to have juicy wines tomorrow, they have to replace your measure. Are you getting it now? Show up, keep showing up. Don't give somebody your time. Don't waste your time. This is a nice time. Let's join tonight. So are you getting it now? Don't stop me, ladies and gentlemen. Once again, right now, so we take all the time. MSc Mastery to you, Medicine and Surgery Concept Mastery. You can't, I promise you, you cannot miss it. You are going to think. You see all these things I saw in strength and strength. We'll be mastering it small, and before you know, I'll be mastering abdominal vessels and the structures and the arteries and the veins that supply, that drains and all that. You see, by the time we are spend some time in it and you gain some time in it. All right? I don't want to start again. Me, I can push it straight because it's exciting. But let me know because you are not talking. So that's why in the night you come and bring someone you bring talk. You can gather in your team and let us know connect you and all that. So that's why you should subscribe and comment so that the comment will let us. I want you to do a live stream video and all that. We'll send you the link and we'll connect you. Are you getting me now? We want to make this interesting so that medicine can be like as if you are watching home movie, as if you are home theater, as if you are, because reading is not interesting. When you carry people to read, you are sleeping and all that. So in fact, less anything. Okay. See you again by 6 p.m. All right. Bye bye. Okay.